Hey friends, today we're diving into something that a lot of people are talking about, cannabis. Whether it's weed, THC vapes, edibles, or Delta-8 gummies, it's everywhere, and it continues to get a lot of hype. Before we dive into the risks, I want to be clear. Cannabis does have legitimate medical uses. For example, CBD, the main non-psychoactive compound found in cannabis, is FDA approved in the form of Epidiolex to treat rare and severe types of childhood seizures. And on the other hand, THC, the compound that causes the high, also has approved medical uses. Synthetic versions of THC, like dronabinol, maybe you've heard Marinol, same thing, and Nebulone, which is also called Sesamet, are also used to treat nausea from chemotherapy. These same synthetic versions of THC are sometimes given to people with appetite loss because of cancer or AIDS. And although there's no FDA approval for this, there's also some solid evidence that cannabis products containing THC can help relieve chronic nerve pain in adults, especially when other treatments have failed. So yes, cannabis and its compounds can help people with serious conditions. But today's video is about how cannabis impacts our mental health and about how you can make informed decisions, especially if you're young and you're taking medications that cannabis might interact with. What do I mean by young? Well, you want to be very careful with cannabis while your brain is still developing, which, by the way, it won't stop developing until around age 25 for women and 27 for men. And again, if you're taking psych medications, they often interact with cannabis. So, what does cannabis actually do to your mental health? Let's have a chat. No shame, just facts, hope, and a little wisdom. First, let's clear up what cannabis is. Cannabis is a plant that contains hundreds of chemical compounds, but two of the most well-known are tetrahydrocannabinol, or THC, and cannabidiol, CBD. THC is the one that can get you high. It affects parts of the brain responsible for memory, learning, coordination, emotions, and decision-making. CBD doesn't make you high, and it may have some medical uses, like treating seizures, but it still has some side effects and interacts with other medications. Now, some of you might be thinking, but they're natural. It grows from the ground. True, but so does poison ivy, and we don't roll around in that for fun. How about psychedelics? What's the risk? Psychedelics like mushrooms, LSD, or MDMA are trending, aren't they? But here's the tea. Trips can flip to terror. Up to 15% of clinical trial participants experienced severe anxiety or suicidal thoughts during psilocybin sessions. Your brain is still wiring itself till your mid-20s, right? So, high-dose psychedelics can scramble that wiring, boosting the chance of lasting psychosis, especially if you have family mental health history. Mixing psychedelics with SSRIs or stimulants can spike blood pressure or cause serotonin syndrome. Not fun. Bottom line, just because Silicon Valley calls it microdosing doesn't mean it's micro risk. But do they ever help? Short answer, sometimes they do, under strict medical supervision. Psychedelics are an exciting new frontier in psychiatric pharmacology. So, what evidence do we have about all these drugs so far? Let's start with CBD. The only FDA-approved use is for childhood seizures. Evidence for anxiety or sleep? We do have about a dozen randomized controlled trials showing small to moderate benefit for episodes of anxiety. The key here is that CBD is the dominant chemical in those studies, not THC. But the evidence has not risen to any approvals yet for this kind of use anywhere in the world. THC. Synthetic THC, dronabinol, is legit for chemo nausea and AIDS wasting, supported by randomized controlled trials, and we know for that we have moderate evidence. Now, since psilocybin and MDMA have yet to obtain a single FDA approval, here's a science hack. Your healthcare provider looks at systematic reviews or meta-analyses first, at the top. Think of those like someone reading all the student assignments on a topic, checking which ones are good, and then putting the best parts together to see the big picture. If there aren't enough studies to look at, researchers can't do systematic reviews or meta-analyses. When a certain treatment doesn't have those, your provider next looks at randomized trials, where people are randomly picked to get the treatment or not, and then that's compared. When that's not available either, they look at observational studies, where they just watch what happens if you get the treatment, without comparing with the group that is not getting it. And if none of that exists, then your provider pays attention to case reports, stories about one or a few people. These are small studies. They can give ideas, but we can't trust their findings enough to think that they would apply to our patients as well. For psychedelic treatments like MDMA or psilocybin, scientists are doing a lot more research now. There are already some early systematic reviews summarizing what's been found, but no FDA approval yet, and the big official guidelines that healthcare providers like to use are still being made. Alright, let's get just a little more specific. Psilocybin. We do have two big randomized controlled trials that show improvement in severe depression, but safety concerns mean that the research still needs some more development and clarity. MDMA. Phase 3 trials for PTSD are done, and an FDA decision may come as early as 2025, but that remains a big question mark. So let's talk mental health effects. This is where it gets real. Anxiety and panic attacks. Listen to this. Using cannabis actually doubles your chance of developing an anxiety disorder. That's right. Twice the risk, especially if you started using it young. Psychosis and schizophrenia. A study published in the Lancet Psychiatry, an important journal, showed that up to 50% of new psychosis cases in Amsterdam could be linked to high-potency THC exposure, and 43% of psychotic breaks were linked to regular but daily THC use. That's a lot of unnecessary psychosis. For some people, it's temporary, but for others, it unlocks a door in the brain that doesn't ever close. Memory and focus. Long-term use can impair learning, memory, and attention. In teens and young adults, this can affect grades, motivation, and emotional regulation. Now, when you're young, that's when you need learning, attention, and memory to go through school, to start a career that will bring meaning and resources in the future. Mood disorders. Cannabis also impacts our mood, sometimes long-term. It is associated with symptoms of mania, like increased symptoms, depression, suicidal thinking. People sometimes use it to cope. I get it. But it can actually make those things worse in the long run. Okay, now let's get into something super practical. What if you're already using cannabis? Or your friend is? Here are some practical steps. Number 1, keep it honest. Ask yourself, why am I using it? Is it to escape? Is it to fit in? To feel better? To sleep? To manage my anxiety? My nerves? These answers can tell you a lot. Your heart is more important than your habits, but your habits will impact your heart, and your heart will impact your habits. There's no way around it. Just like our actions affect our beliefs and vice versa. Some things are paired up by design, like two-way streets. 2. Delay and reduce. If you haven't started yet, amazing. The earlier you start, the more damage you can do. Every year you delay makes a difference. If you're using, reducing how often and how much can at least lower your risk of mental health problems. Switching from high potency THC to lower doses can help too, even though sometimes it's hard to find. Watch your meds. That's number 3. Cannabis interacts with common psychiatric medications. Here are the main ones affected by cannabis use. With SSRIs and SNRIs, usually prescribed for depression or anxiety, cannabis can affect how these drugs are metabolized in the liver, possibly changing how well they work or increasing their side effects. With stimulants, usually prescribed for ADD or ADHD, THC can intensify anxiety or heart-related side effects. With anticonvulsants and antipsychotics, cannabis works against the medications, often making symptoms worse. These meds are pretty common and they're used for so many things in psychiatry, like mood, mania, psychosis, and even anxiety and PTSD. When I hear that my patients are using THC, is that concerning to me? Yes. That is why I'm making this video. But don't hesitate to talk to your healthcare provider about your cannabis use. For real, our job is not to judge or expect that you make changes, unless you want to. Our job is to meet you where you are and empower you to live the life that you want to live, regardless of where you stand. Alright, so if you're using it and are not ready to even talk about change, that's okay. Your provider just needs to know what you're using, how much you're using to keep you safe. And another important thing is to know where you're getting it, because that will determine the safety of it as well. If you decide to make any changes to how much you use, they need to know that too, and they will be happy to support you on that journey. How about CBD only? CBD doesn't get you high, true, but it isn't risk-free. It can damage your liver, interact with meds, cause drowsiness, or GI issues. It also hasn't been shown to help with most things that people use it for, unless you're specifically treating childhood seizures. And no, it's not a vitamin. So, to wrap it up, cannabis is not harmless, especially for teens and young adults. It can double your risk of anxiety disorders and can lead to psychosis and even schizophrenia. It messes with memory, focus, and emotions. It can interact with meds and mess with your treatment plan. But most of all, there's hope. You don't have to be stuck in a habit or a fog. Real peace, healing, and clarity are possible. Number 4, get support. If you decide to stop or cut down, you won't have to do it alone. Whether it's a school counselor, a therapist, a pastor, or a friend who really listens, having someone walk with you matters. There are also great free resources like samhsa.gov, and that is SAMHSA.gov. There's the Build the Brain campaign, 60-second videos on marijuana risks from the CDC and SAMHSA. And then number 5, fill the gap. We were made with a desire to connect and to be in community with others. Cannabis, like other drugs and like many habits too, distract us from that. They don't satisfy us long term. If you cut back or stop using it, something will need to take that place. Replace it with something life-giving, like more music, nature, sports, prayer, journaling, serving others, and more real conversations. When you fill your life with what's truly good, there won't be much room for what drags you down. Thank you for hanging out with me today. If you want to learn more, I put together a PDF of this video with all the references. There is a link for it in the description. You've got this. See you next time.